So we're going to be talking about non-traumatic musculoskeletal disorders today. So we've been focusing on the traumatic ones before. Today, basically, we're going to focus on those that are non-traumatic. What we're going to do is, again, we're going to talk about the epidemiology of this, the process of how this works, some different treatment options, and what we're expecting to see with that patient. With this, again, these are going to be related usually to non-traumatic type of injuries, or they can be overuse injuries, inflammatory injuries, autoimmune diseases. Our two main doctors who are going to be seeing most of these patients are rheumatologists for our arthritic conditions and physiatrists, which basically do for our MS, MD, and they're also going to be physical therapists and that's such for our overuse chronic injuries. So musculoskeletal system, we're looking at just a review of everything as far as our skeletal system, bones, joints, ligaments, connective tissues, and these are going to inform a lot to our bones, joints, and connective tissues. This is going to be our main focus is going to be a lot of joints with some of these two here, and I'll review that. So again, in review, skeletal system, 206 bones. Long bones, short bones, flat bones, irregular bones. You guys are all familiar with those. We got our long bones and extremity, short bones. So I'm going to show you a picture. You guys know the position. I'm expecting you guys know this, and this is just a review as far as where the bones are located, positionings, irregular bones, long bones, and flat bones. Again, on our long bones, I do want you to know where the epiphysis is, the epiphyseal plate, especially in kids, the metaphysis, the diaphysis, all that information. Again, this is just review for you. You should know of what's compact bone, where's cancellous bone, and then up on the tip of the joints that we're dealing with our cartilage. So our skeletal system has multiple joints as well. We have our gliding, hinge, saddles. I'm going to show you a picture here, and I just want you guys to be, again, very familiar with them. You don't have to be so specifics, but know where the different type of joints are, especially our ball and socket joints, our movable joints. We have cartilage that's going to be in there. We have our connective tissue. We have most of the cartilage, especially the articular cartilage, is going to be avascular inside there. And then we also have cartilage in the ears, around the ribs, other aspects as well. Hyaline cartilage lines your bone around the joints. That's going to be your initial in there. But on the hyaline, you also have your articular cartilage. You also have your elastic cartilage around the outer ear, and then the fibrocartilage is basically around the bones, intervertebral discs. When we're dealing with most of this information, again, the cartilage area, I want to focus more especially on the articular cartilage or within the joints. So picture of a joint here, basically you have your joint capsule, you have your articular cartilage that's in there, and that's what can be damaged. You have your ligaments inside. Knee joint is most commonly affected with traumatic, but it can be non-traumatic as well, overuse and stress injuries. We're going to look a lot of finger and toe joints as well when we start dealing into the arthritic conditions. When we look over here, again, musculoskeletal system, this is all a review for you of knowing where the muscles is, where the anatomy, how they work. I'm going to show you a picture and again review that. Nothing new as far as any information here. This should be all specific review for you guys. So here again is the anatomy pointing out specific muscle. It's always good to know the different names of the musculature, pointing those out. This should all be, again, review for you guys as well. So in assessment, especially when we're dealing with non-traumatic, we're basically going on a history, trying to figure out what's going. We're dealing with pain, tenderness into the joints. That'll be a big aspect of this. Everything else is going to be basically related on history, doing a focus exam, but reviewing patient's medication, their history, how long they've had this, what's been going on is going to make you your determination. Realistically, most of this is going to be comfortive, palliative type care. So back pain, again, same thing. We're going to do a neurological exam. This wasn't trauma related. What's been going on with this? Pain management is going to be the big thing, splinting as needed, and getting them in for evaluations, follow up with their doctors. These are, again, chronic overuse injuries that have led up to this, and some of them are also going to be microscopic tears from those areas, minimal things that we're not going to do a lot for. As we get into the arthritic injuries as well, we're going to talk about those joint damages and everything else that's involved. So the things we're going to be looking at, especially with the overuse injuries, are basically going to be our pain and tenderness. They're going to have possibly decreased range of motion or restriction, either due to pain or swelling. So with our tendonitis, we're going to get inflammations in the tendons themselves. This can be like tennis elbow, can be actually in the ankle joint and everything else, golfer's elbow. The other thing we're going to get is what's called tenosynovitis, and that's basically swelling in the sheath. So the tendon is fine, but it's the sheath has the swelling. We have bursitis, or basically these bursa swellings that can cause pain. And then we can get into chronic areas like chronic myalgia. And this is basically injuries of the muscles and continued repetitive use. Other injuries we'll come across is like carpal tunnel syndrome and tarsal tunnel syndrome. This is basically where we get swelling around a canal that push pressure on the nerve and causes numbness and tingling down in the hands. And then obviously we have degenerative conditions as well. These are going to be due wear to tear, aging type of injuries that we're going to see over a period of time. When we're dealing with the joints, there's a couple types of arthritis. Osteoarthritis is the most common one we're going to see. This is a degenerative joint disease, and it's basically associated with wear and tear and aging. When we're looking at this, we see pain, swelling, usually stiffness, but as they get moving or get the motion going into it and that activities, they can actually do better, but chronically over a period of times, they're going to have injuries. This is basically some hands with osteoarthritis. We'll see it really commonly in the knees, ankles, especially in athletes. You're going to see it in there. Osteoporosis obviously is a condition where we're going to get decreased calcium in the bones, and the bones are going to be less dense. This happens mostly in females with lots of estrogen, but it can happen to men as well, and we see this over a period of time. Usually what we do to prevent this is if we can get increased activity, still weightlifting and other aspects, we can tend to reduce this. But the big thing here that we're doing is they're going to be seeing medication by their doctor, calcium replacement and medications. Not much for us to do. Degenerative disc disease, this is going to be, so with our degenerative conditions like degenerative disc disease, basically what you're going to get is the discs that we have that are between the vertebrae are going to break down. These are fluid filled, so they can become dehydrated, they become stiff, they don't have as much absorption for pressure, and you can get cracks on this. Also, when we have degenerative disc disease, these allow to herniate a lot easier, so that herniation is going to cause pressure on the spinal nerves, which can basically cause pain. It can cause loss of function, it can block blood supply, lots of different things that can happen with it. Our inflammatory conditions, basically inflammatory portion is to basically bring in white blood cells to heal the area. But the problem with this is as it inflames, it brings swelling with it, which brings blood supply, and it brings basically pain on the areas. So one of these conditions is called rheumatoid arthritis. This is a degenerative disease that body kind of attacks itself. It's an autoimmune process. Affects mostly women, but affects men as well. Most commonly you see this in the hands, and you'll see the hands are actually deformed because of the changes into the joints themselves. They're very painful. The only thing with this that they could be doing is seeing a rheumatologist and taking chronic medication for this, for the pain, and trying to decrease that swelling. But once they get the hands degenerated, which we're going to see here in a minute, there's really not much that can be done. Only thing it can really do is you can do some surgery to fuse those joints in most cases, depends on how early you catch it. So here's kind of a picture. It's going to show how degenerative those changes are, and so there's really not much left there to do except to fuse those joints and basically straighten out the fingers. Again, we see this kind of patient who's in extreme pain. The only thing we're going to be doing is taking care of pain management on this, but this is someone who's going to be seeing their rheumatologist. Ankylosing spondylitis is basically an inflammatory process. It affects the spine itself. This does the joints between the vertebra and the sacroiliac joints. These patients are going to be very painful, hard to move, bending over, chronic back injuries, and really the only thing they're doing there is they're doing a lot of fusions for this process because it's broken down the joints so much there's no cartilage. Again, for us, we see a patient like this, we just have to be careful as far as moving them, but there's not a lot that can really be done on our things except for pain management, being very careful to move them. Because you move the neck, you move the back, you move any of those things, it's going to cause extreme amount of pain, and actually you can actually get some problems with the inflammation pressing on the nerves. So here's kind of a showing of what's happening there, where you're actually getting fusion of that anterior aspect between the bones, and that's why that makes that so stiff. And you actually bend that or move it too much, and that area breaks, can actually cause pain on the nerves themselves. SLE, or lupus erythematosus, is basically another autoimmune disease where the body basically attacks itself from organs, joints, skin itself. They can become very painful, be very dark in area. Again, usually these people have got a presentation across the face and kind of this mask appearance, and I'll show you a picture of that as well. And these are going to be patients that can be normally fine throughout the day, and then they'll flare up at certain points in time. So if you see this chronic kind of red mask appearance across there, that's standard for SLE. Again, these are going to be symptomatic. Someone's going to call you when they're having an attack or something like that, and we're going to be looking at fluids, pain management, and getting them in. Gout is another common disease. You'll see this mostly in middle-aged men, most commonly after eating fatty foods. It is actually uric acid, and what happens is we get an extensive amount of uric acid buildup. Uric acid will then form these little crystals, and they're tiny shards almost that will coalesce together. Very painful in there. You either treat, this one is going to be for pain. You put your hand next to a finger joint. This is most commonly in the big toes, the big area, but you can see this gouty tophi that's built up. If someone's having an acute gout attack and you put a hand even close to it, they're going to say that hurts. Realistic treatment is for either trying to excrete more of it or fight it off. This is again something that's going to be taken care of by the rheumatologist. Our infectious conditions are basically anything like cellulitis, anywhere where we're getting infection into the tendons, the skin. Cellulitis is going to be our common term, which normally see that redness. Instead of an erythema, it doesn't go away with decompression or oppression on the area. Fasciitis is, again, we're going to be dealing with our deep fascial tissues. These areas can also become infected, usually in sepsis type conditions or a localized puncture wound, things like that, where it's got an infection into the area and can break that area down. Really, the only thing we're dealing with here is we're dealing with antibiotics. For us, you get someone who's in this situation, we're looking at fluids, we're looking pain management, and getting them into the hospital for antibiotics. I talked a little bit about tenosynovitis before, but basically the tendon itself is surrounded by a sheath so it can move in. So when we get swelling within that sheath, which can happen, that's basically going to cause pain around the tendon. The tendon is actually okay, and the only way to get this done is basically with antibiotics or draining as needed. Gangrene is once the infection is proceeded. There's actually several types. There's a gas gangrene, there's a liquid gangrene, but it's realistically when the tissue has died itself in there, and so that area is broken down. It can be everywhere from a green to blue, black. If you have an open area with gangrenous area, it is an acridine smell, very disgusting as far as things would go. Surgery is going to be the main portion to do this, but sometimes we allow areas to auto-amputate. So if we're dealing with a diabetic with an issue like this could have been a frostbite where the tissues have died. Sometimes we let those auto-amputate or fall off because they can't heal them up to that point, and the body will purposely do that. When we're dealing with our diabetics, again, diabetes is a small vessel disease. So what happens is the small vessels clog down, they actually clot off, and they're unable to feed blood supply to small areas, especially in the distal area. Usually it happens down to the feet because it's furthest away from the heart. Then it comes in hands, also affects the eyes very frequently. Someone loses blood supply down to the area. What will happen is it shuts off blood supply to the nerves. The nerves die. People get a condition what's called neuropathy, or basically they cannot feel when they're walking. They can walk on an area where normally you and I would stop. They'll actually wear a hole or an ulceration in the bottom of the foot. So because of this, they can get breaks in the skin. It opens up, allows for more infection, and we can get a condition called osteomyelitis or infection in the bone. Once we get in that, very difficult to treat. A lot of times it's surgical treatment for that to remove. They can be done with antibiotics and other aspects too. Depends on the type of osteomyelitis we're dealing with, if we're looking at a benign or a malignant type of disease process. Again, we're not going to see this much as far as a paramedic. Here we're looking at a diabetic ulceration on the foot. You can see nice red down below after someone has debrided this area, but they've been walking chronically over this area and they have no feeling. They may not know that there's any pain. So tough process, and because they have limited blood supply, hard to heal. Now with the osteomyelitis, basically we may not know as far as symptoms or anything like that. Usually they're going to complain of pain. They may have an open area that's down affected to the bone, and the only way to diagnose that is with x-rays and other aspects. The septic joint is basically when we get a bacterial infection within a joint. These people are also going to be red, swollen, painful, And the only thing we can really do is surgery and antibiotics at a lot of those times. The only way to diagnose it usually is to put a needle into the joint, do an aspiration, and test labs. Someone's complaining of a foot that's swollen and painful. Realistically, same type of thing. You're going to do an IV. You can do a little bit of pain management for them, but there's nothing we're going to be doing as medics. Other things that we'll see is neoplasms, tumors, and different other musculoskeletal tumors that will develop in the muscle as well as down into the bones. With these, not much we're going to do as far as treatment. It's just kind of recognizing that the process is going on. Bone tumors, you're not going to find out or know unless they'll be able to tell you. Osteochondromas are basically where the bone has still got a cartilage aspect to it and forms a tumor. These are going to be diagnosed by x-ray. Malignant bone tumors, these are chondrosarcoma, Ewing sarcoma, osteosarcoma, fibrosarcoma. All I want you to know about that is they're out there. You may have someone who's aware of that. We're going to be looking at pain management. There's nothing from a paramedic side we're going to be doing on those. And as well as any other malignant tumors that are going to rise. Rhabdomyosarcoma, basically this is a muscle disease. Everyone should know what rhabdomyolysis is. Rhabdomyosarcoma is basically the position of the tumor within the skeletal muscle. There's going to be very painful. There's going to be usually swelling and deformity, and the body's going to bring in try to heal this. Because of this area in the muscle or with some of these other neoplastic areas, you can actually get bones to fracture very easily. The other type of chronic pain syndrome that we have is basically going to be undiagnosed in that sense of what's actually causing the problem, and there could be multiple things. So people call it by chronic myalgia. And basically it's a garbage term for we don't know exactly where they're getting the chronic pain from. This says pain can last excess of 3 to 6 months. People can have this for their lifetime, and their long-term treatments. Again, we're going to just see them complaining of pain. Same as what we call the fibromyalgia. Within the fibrous tissues, muscular tissues, we don't really know exactly what happens that, and those are going to be people under chronic pain management. We may be basically just do palliative care just to get them into the hospital for them to see their doctors. With our fibromyalgia patients who say they're there, sometimes we will do pain medication. I'll do a better pain lecture for you later, but that's kind of a judgment call on where we're at. RSD, or reflex sympathetic dystrophy. This is a chronic condition where there's swelling and decreases they allow movement of the arms or in the reflexes. This is something you probably won't see very often, and it would be coming across someone who complaining of recent pain and unable to move it. Steroids are going to be the biggest thing that we do, as well as nerve blocks. And then when we're dealing with rheumatitis, other condition we're going to see is a juvenile rheumatoid arthritis. This is going to be very similar to our rheumatoid arthritis, but with kids, again, very debilitating. They're not able to move active like they normally would. Osgood-Schlatters disease, basically this is the anterior tibial tubercle. This is basically dealing with the growth plate on the anterior tibia, and so when kids are trying to run, grow, move, they're causing contributed pain. A lot of the times, basically we not only put them on ice and anti-inflammatory medication, but we have to take them out of sports and active activities. There's some new things we're trying to do to keep kids more active. A slip capital femoral epiphysis is basically when we're dealing at the ball of the hip joint. Again, this happens basically hip areas. There's not a lot that can be done in this portion except for that initial trying to get it diagnosed, and then surgery is going to be the big area. And the hard part with this is taking kids completely out of activity with surgery on there. You're probably not going to see this so much, but you see these are going to be kids that are going to be diagnosed with their family care docs. So most of these areas we're not going to see and treated. We're going to see more traumatic type of things. But when we do see people complaining of pain or having this aspect, it's being aware of that they are. Most of our treatment that we're going to be doing is going to be just symptomatic. We're going to be doing pain medication. We're going to be transporting. We're going to know some of these things that are going on. It's just being aware and not being afraid to use pain medication to help these patients through these type of symptoms. So I want you to just be aware of kind of what's out there, and we'll talk more about this in class.